Hi there, this is Kristen Wilson. This is our video presentation number one. So we'll get started. My participant in this case was a little girl. She's 2 years, 2 months old, so 26 months. She is Caucasian. So general home life, she lives with mom and dad. She's an only child, so no siblings. They do have a dog. Daycare, she's actually been going since I think the end of February 2021 to Hand in Hand Daycare. She's in the 2 to 3 year old program, and there's approximately 10 other students that are in class with her. So talk about prenatal development and birth. So talk to mom about that. Stress levels she felt were pretty normal stress levels for a teacher. This is the teacher that I work with. She had, very regular prenatal appointments, prenatal vitamins, so she had good nutrition. She overall said it was a very easy pregnancy. She thought the most stressful part of her pregnancy was preparing for her maternity leave. Like I said, she's a teacher, so trying to prepare lesson plans for that. The little girl was actually due on December 31st and was born on December 30th, so she was kind of right on time. Her birth plan, she actually felt like the whole experience was very positive. She felt like they actually followed her birth plan pretty well. She did have to be induced, but again, just the whole experience for her was very positive. As far as, so thinking about breastfeeding versus bottle feeding, she had decided even prior that her baby was going to be bottle fed, and she had a few different reasons for this. One reason she wanted to bottle feed was so that dad could share with the feeding responsibilities, like feeding in the middle of the night and things like that. Also, she herself, she said, was a formula baby, and she was fine, so she felt that her daughter would be fine as on formula. Another aspect she had thought about was she didn't want to have to necessarily pump at work for breast milk. So for those reasons, let's see, I think that's all I had. So then moving on to physical development, her current height and weight. So she's 26 pounds, and I looked up that chart, and that puts her at approximately the 25th percentile. Her height is 33 inches, which is approximately the 50th percentile for her age. Thinking about her gross and fine motor skills, what I noticed was, she walks pretty smoothly. She kind of running, kind of more like hopping. She's very active. She can carry her toys, pick up toys, things like that. It seems like her grip is pretty good. I did notice that, like, holding a marker, her grip's a little bit clumsy with a marker still, like when coloring and stuff like that. She claps. I didn't actually have an opportunity to see if she could use like a spoon to feed herself, but she can definitely like hand feed herself. They had some snacks and stuff out for her. So like I said, her grip is okay, not great on that marker. She also, I saw her like flipping pages in a book, but it was a chunky children's book, so the pages are a little bit thicker than a normal picture book. So she was able to flip the pages. I'm not sure she really understands like how a book works yet. I know she's a little young for that. I think she just enjoyed like flipping him back and forth for that kind of the movement of it. Sleep patterns, per mom, I guess they did sleep training. So she, since about 6 months old, has been sleeping through the night, approximately about 12 hours that she'll still sleep straight through. I did fail to ask about naps, if she still naps or if she has to nap while she's at daycare. From what I saw of her, she's actually very, very active, but I did forget to ask about napping patterns for her. Health and nutrition. So mom says that she is becoming pickier now than she used to be, so that she used to eat fairly well in a variety of things when she was younger, and that she's gotten much more picky, but that's very typical for toddler years, like ages 2 to 4. Kids do tend to get picky at those ages. So what I noticed, like she didn't want chicken nuggets, she refused some apple slices, but peanut butter and jelly is her favorite. So like her ideal meal would just be peanut butter and jelly, like 24/7. So she also, I noticed too that she kind of grazes on things, so they're left out. So she just eats a little bit here and there, which again I think is pretty typical for that age. As far as vaccinations, she's current on all of her vaccinations. Did not ask about COVID, however. So for cognitive development, I noticed joint attention, that she looks at the speaker to listen, and she'll look at a person to actually gain their attention as well. She also says, mommy, to get attention. Thinking about Piaget's different levels, so I think she's still in the sensor-motor stage, maybe on the cusp of like pre-operational stage, somewhere in there. I did notice for language, like the use of simple sentences. She does also still kind of like mix up or have incorrect use of pronouns, like it'll be her says instead of she says. I noticed that when she's talking, it's almost like a sing-song quality to her speech, which again I think is pretty normal for that age. She also, well, a note for the mom here was that since she started at daycare, that she's noticed an increase in her language and vocabulary as well. So she, for instance, knows the names of the colors. What I noticed, though, she didn't actually correctly identify them. So she could say the names of the color, but you show her yellow and she said, that's blue. And mommy would say, well, no, that's yellow. And she'd be like, yellow, okay. So she does know like her letters of the alphabet, and she can sing the song, and she can also count to 10. However, I don't know that she actually understands that, like if you showed her the number 9, if she would be able to identify that as the number 9. But verbally, she can count, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Her vocabulary seemed very typical to me for a 2-year-old. Mommy, daddy, doggy, dolly, baby, all gone, no, yes, hi, milk, more, those kinds of words. And that seemed very, very typical for that age. Emotions, self, and identity. Talking about temperament and personality. Well, she's very much a 2-year-old, so she's very self-centric. And everything kind of revolves around her, what she wants at that time, what she needs, if she wants your attention, all of those kinds of things. And she will say things like, no, it's my belly, it's my dolly, it's my baby, right? But she actually overall, very happy child. She is very dramatic, overly dramatic. She got a little boo-boo, and there's like, mommy, I have a boo-boo, and you have to kiss it. So very, very dramatic. But silly, happy, laughing. Thinking about any signs of ASD, there is no indication at all that she has, that she's on the autism spectrum disorder. She's not in that range at all. I'm a special education teacher, and I didn't see any indication of ASD in her at all. There is a note of a negative behavior since starting in daycare. Mom says that she had been bitten by another student at daycare, and since then that she has actually started biting others as well. So when I was there, we talked about it, and mom just says something like, they're working on keeping their teeth to themselves, and she'd ask, it's not nice to bite. It's is it nice to bite our friends? And she said no, but she made like this really grumpy face, and she's like, no, and so then mom said again, that biting is not nice, and we don't do it. So thinking about some extra or something that stood out when watching and talking to mom were really the effects of COVID on social skills and social development of children. So when she was born, at the end of December, mom was out on maternity leave, and she would have come out from maternity leave is when we all went home for COVID that first time. So basically she was home alone for 14 months, really with just mom, because dad still had to work at that time. So talking about, she had, no exposure to other kids, other family members, really. She had never even seen another kid till she went to daycare. She became extremely dependent on mom in that sense, and then wouldn't even like go to dad when dad was home. And and that puts a lot of strain on mom a lot of strain, I think, on her as well. So there were some issues when she first started with daycare, with learning to socialize and make friends and things like that. And what it makes me wonder is this group of kids, when we have some of those developmental or social milestones, like how is this going to affect them as they move on through elementary school, junior high, and high school, or as adults? So I noticed with me, for instance, she was very shy with me initially, but she did warm up in the course of it. She could tell that, her mom and I knew each other. We worked together, and I just, like I said, that's just something that I'm curious about, and can kind of check in, for as long as I work with mom. So overall, that is my review of my subject. Again, it's a 26-month-old little girl. Thank you.